Hello everyone, I am Dr. Hamza Al-Ashwah and this is a new case of our frame to get more marks in the MRCS examinations. The case of today is lipoma, which is a common case related to the thrush. Okay, we have our frames. After introducing the room, wash your hands and introduce yourself and confirm patient details and explain the examinations and again the consent and also ask for the exposure and offer the chaperone and ask about the pain. Don't forget this. And for any swelling, we have to inspect and also we have to palpate. And don't forget in the end to thank the patient and wash your hands again. We have to go by details. Wash your hands and introduce yourself. Hello, my name is Dr. Hamza. Could you please confirm your name and age, please? Okay, and try to explain the examinations. If the lipoma in the back of the patients, I have asked today to examine the swelling in your back, which including look and feel and doing some special tests. Was that okay with you to gain the consent and also ask for the exposures if there is a back? The examinations including exposure of the swell and expose your whole neck, which is that okay with you, and also the examiner with you as a chaperone, which is important one in our frames. And don't forget to ask about the pain before you start the actual or the real main or the main scope of your examinations. I mean the inspection palpation. Before you start, do you have any pain at the moment? And the patient, no. Okay, you have to go. If the patient, I have a pain, I'm sorry for that. Do you need a painkiller or something like this? And go for the inspections and palpation. The inspections as any swelling, close look for the 6S, side, size, shape, symmetry, skin overlying, and scar. We have to change the color to be clear. Okay, I'm sorry. And also, would you please look down, look of its look of any changes, شوف أي look for any changes, any difference, or okay, or mobile change in the locations or change in the size, any changes, okay, and you have to look for the 6S as we said. By palpations, don't to ask about the pain before you touch the patients. Do you have any pain at the moment? Again, okay. Would you please look down to make the lipoma in action and more clear, more pointed to you, and palpate the size by tap of your hands and palpate the temperature by the back and tenderness, surface, edge, margins, consistency, reducibility, which is related to lipoma, compressibility, and pulsations, fluctuations, which is important, fixations to skin, mobile or not, fixity to deeper structures, and the mobility, hard mass between your index and thumb, and move into two directions. The neck lipoma asks the patient to look down and move the lump in two directions. And don't forget the trans illuminations one, which is important also in the lipoma. And don't forget this one, assess the regional lymph nodes, whatever the site of lipoma. And don't forget, as we said in our frame, in the end, thanks for letting me examine you. Do you need any help? And go for your examiner and try to present your case and wash your hands before you go to the examiner. You have to collect more marks by this frame. I promise you. Thanks for your listening.